Good day everyone! Today we're gonna talk about type 1 reactions, or also known as anaphylactic reactions. The first one is systemic anaphylaxis. Systemic anaphylaxis occurs to 2 to 30 minutes after a synthesized person is re-exposed to an antigen. Anaphylaxis means the opposite of protect. From the prefix ana, meaning against, and the Greek phylaxis, meaning protection, anaphylaxis is an exclusive term for reaction caused when antigen is combined with IgE antibodies. Anaphylactic responses can be systematic reaction producing shock and breathing difficulties that are sometimes fatal. However, they may also be localized reaction, including common allergic conditions such as hay fever, asthma, and hives, slightly raised, often itchy, and reddened areas of the skin. The IgE antibodies produced in response to an antigen such as an insect venom or plant pollen bind to the surfaces of a mast cell and basophils. Both cell types are similar in morphology in their contribution to allergic reactions. Mast cells are especially prevalent in the mucosal and connective tissues of the skin and respiratory tract in the surrounding blood vessels. Basophils in the bloodstream are recruited to the site of an infection. Mast cells and basophils contain granules of histamine and other chemical mediators. This shows the IgE antibodies produced in response to an antigen. Coat mast cells and basophils when an antigen bridges the gap between two adjacent antibody molecules of the same specificity. The cell undergoes degranulation and releases histamine and other mediators. Mast cell and basophils can have as many as 500,000 sites per cell of IgE attachment. The Fc stem region of an IgE antibody can attach to one of these specific receptor sites on such a cell, leaving two antigen binding sites free. Of course, the attached IgE monomers will not all be specific for same antigen. But when an antigen encounters two adjacent antibodies of the same appropriate specificity, it can bind to one antigen binding site on each antibody, bridging the space between them. This bridge triggers the mast cell or basophil to undergo degranulation, and a cellular process that releases the granules inside these cells along with the mediators they contain. This image right here shows a degranulated mast cell that has rejected with an antigen and releases granules of histamine and other reactive mediators. Systemic anaphylaxis or anaphylactic shock results when the release of mediators causes peripheral blood vessels throughout the body to dilate, resulting in a drop in blood pressure. In addition, symptoms including narrowing of airway passages causing respiratory distress, flush or skin rash, tingling sensation, and nausea. These reactions can be fatal within a few minutes. There is a very little to time act once someone develops a systematic anaphylaxis. Treatment usually involves self-administration with a preloaded syringe of epinephrine, a drug that constricts blood vessels and releases the blood pressure. Even a small dose of antigen in question may cause a systemic reaction in someone who is sensitized to it. Inject antigens are more likely to cause a dramatic response than antigen introduced via other portal entries. People who are allergic to the venom of sting insects such as bees and wasps are at risk of systemic reaction. The risk of anaphylaxis is one of the reasons why healthcare providers ask patients about any known drug allergies before treatment occurs. Localized anaphylaxis. Localized anaphylaxis is usually immediate, temporary, and less severe than systemic anaphylaxis. Localized anaphylaxis is associated with antigens that are ingested, food, or inhaled pollen. The symptoms depend primarily on the route by which the antigen enters the body. An allergic involving the upper respiratory system, such as hay fever, sensation of production of IgE subsequently involve mast cells that release histamine in the mucous membrane of the upper respiratory tract. The airborne antigen might be a common environmental material such as plant pollen, fungal spores, feces of house dust mites, and other animal dander. Here you can see a picture of a micrograph of a pollen grain and a micrograph of a house dust mite on fabric. The typical symptoms are itchy and teary eyes, congested nasal passages, coughing, and sneezing. Antihistamine drugs which compete for histamine receptor sites are often used to treat these symptoms. The hygiene hypothesis. Incidence of immune-related disorders such as asthma, food allergies, and inflammatory bowel diseases are on the rise throughout the developed world. These disorders involve a variety of cells and mode of action but broadly share origin in damaging immune response that results in inflammation and tissue damage. Growing research suggests that the increase in autoimmune disorder may be related to increase of dysbiosis, a harmful imbalance of normal microbiodata among people living in modern lifestyles. Ironically, the good hygiene, sanitation, and antibiotics that people in developed nations enjoy may have be a drawback. Helpful microbes are eliminated along with the harmful ones. According to the hygiene hypothesis, this lack of childhood exposure to microbes result in less microbiome diversity, and that in turn may encourage the development of autoimmune disorders, such as allergies and asthma, inflammatory bowel diseases, Crohn's disease, and Clostridium difficile infections. Preventing anaphylactic reactions. Some individuals experience an allergic reaction after eating an assortment of food and may not exactly know what the food they are sensitive to. In some cases, skin tests might be used in diagnosis. These tests are used for a variety of allergies and involve inoculating small amount of suspected antigen just beneath the epidermis. Sensitivity to the antigen is indicated by rapid inflammatory skin reaction that produces redness, swelling, and itching at the inoculation site. This small affected area is called a wheal. Once the responsible antigen has been identified, the person can either try to avoid contact with it or undergo desensitization or subcutaneous allergen-specific immunotherapy. This procedure usually consists of a series of gradually increasing dosage of the antigen, carefully injected beneath the skin. The objective is to cause the production of IgG rather than IgE antibodies in the hope that the circulating IgG antibodies will act as a blocking antibodies to intercept and neutralize the antigen before they can react with cell-bound IgE. Desensitization is not a cure for allergies and has a varying levels of effectiveness, with the most success seen against inhaled and injected allergens. This table shows the ABO blood group system, which shows the illustration of the plasma's antibodies and cells that can be received. And that's the end of my discussion. Thank you for listening.